This complex case study is presented by Virginia Knight and Carrie Mrazek. Our client's name is Dimetre. He has fractured his right radius and ulna. He is 6 weeks post-injury. Dimetre is a 92-year-old man who is a widow and lives alone. He lived through a great deal in his Russian homeland. He is fiercely independent and he doesn't like to ask for help, and he has a difficult time accepting help from others. He has a bird who he has conversations with daily and he considers family. Recently, Dimetre fell while he was in his bathroom and fractured his wrist. The x-rays revealed a clean fracture to his distal radius and ulna. He didn't need surgery to stabilize the fractures. However, his arm was placed in a full arm cast with his elbow in flexion. 6 weeks has passed since he's been to the emergency room, and he now will be placed into an anti-deformity splint. He has quite a lot of edema in his hand and pain when he moves through his fingers. He's got weakness in his elbow, wrist, and he has difficulty with ranging motion to his elbow, wrist flexion, and wrist extension. He's also having difficulty moving his fingers through the full range of motion. Dimetre's medical history consists of congestive heart failure, non-insulin dependent diabetes, cataracts in his right eye as well as macular degeneration in that eye, and a history of alcohol abuse. Weeks 2 through 8, after the initial fracture, are called the fibroblastic or the subacute phase. The criteria for advancement is evidence of radiographic union or confirmation by physician of fracture, joint and repaired structure to withstand resistance and stress. Dimetre will be released home with an anti-deformity splint. It is recommended during this stage that physical agent modalities be used, such as moist heat before exercising, or a cold pack may be used for edema and pain control. A few precautions to be remembered with a fracture is to exercise only within safe, prescribed arc of motion, to monitor pressure areas over posterior aspect of elbow, such as the bony prominences when splints are used. Dynamic elbow splinting should be avoided until week 8 or later. Monitor the patient for joint instability and check for hard end feel indicating a bony block. The targeted occupational performance problem areas and specific problems to address for Dimetre for ADLs are difficulty with self-care activities, including bathing and dressing. He's having difficulty manipulating the fasteners and the buttons, the zippers when he's dressing. For IDA adults, he's having difficulty with home management tasks such as meal preparation, medication management, cleaning, laundry, and pet care. For social participation, he's having difficulty performing his social roles, such as being a self-carer, a homemaker, and a hobbyist. For play and leisure, he's having difficulty performing leisure activities that require elbow motion. And for work and education, he might be having difficulty with work tasks that require carrying or pulling. For sleep and rest, he's having some difficulty due to the pain that he's having in his hands. For occupational performance skills, Dimetre has sensory perceptual deficits in vision due to cataract and macular degeneration in his right eye. He also has decreased sensation, pain, numbness, and tingling in his right hand. For motor, he has decreased strength and range of motion in his right hand. He also has decreased coordination and dexterity. For performance patterns, Dimetre enjoys walking daily whether it's raining or shining. In his role, he has a decreased ability to carry out his role as a self-carer, and for his routines, he walks to the store 2 or 3 times a week for vegetables, and every other week, Senior Services picks him up and takes him to a larger grocery store for staples. For client factors, Dimetre has a reduction in strength in his right upper extremity. In his shoulder manual muscle testing, he had 4 out of 5. In his elbow, he had 3+ out of 5, and his wrist he had a 3- out of 5. For his range of motion with elbow extension was a -25. For wrist flexion, it was 20 degrees, and for wrist extension, it was 15 degrees. Dimetre has quite a lot of edema in his hand. Regarding mental functions, he has decreased memory, which has made it difficult to remember his medications. In regards to context and environment, Dimetre is of Russian descent, and there is some language barrier as he has not ever taken a whole lot of time to learn the language. There's also cultural sensitivities that need to be addressed, such as he is very independent and does not like asking for help. He lives alone, and he is a widow, and he has no family to assist him. The second long-term goal for Dimetre will be, by discharge, Dimetre will successfully adhere to medication schedule with 90% accuracy 7 days a week by using medication management strategies. The 3 short-term goals that will lead up to that are to use a weekly, daily pill organizer to separate medication into proper quantities and scheduling with 75% accuracy with less than 2 verbal prompts. The second is to use a visual schedule medication reminder and check off appropriate boxes daily 5 days out of 7. The third goal will be to reset medication alarm for his noon pill reminder 6 days out of 7 with less than 2 verbal prompts.